The introduction of Klinefelter's syndrome. When was Klinefelter's syndrome discovered? The question is, when was Klinefelter's syndrome discovered? Klinefelter's syndrome was first found in 1942 by Dr. Harry Klinefelter, when he and his co-workers chose a report of 9 men who have the symptom of enlarged breasts, sparse facial and body hair, small testes and unable to produce sperm. Next is Klinefelter's syndrome. The first one I will talk about the term of this disease. The second one is the symptom of Klinefelter's syndrome, and the third one is we will talk about the treatment of this Klinefelter's syndrome, and the last one is we will talk about Klinefelter's syndrome can be cured or not. So we go for the first one, which is term of this genetic disorder. Klinefelter's syndrome is a congenital disorder in which one or two additional X chromosomes are born in male. It also known as XXY syndrome, and they have variety of complications such as short penis, small testicle and infertility. Then we go for the second one is the symptom of Klinefelter's syndrome. Symptom of the syndrome specified between age where it been divided into 3 categories. The first is the symptom for the babies, the second one is the symptom for the teenagers, and the last one is symptom for the men. Then we go for the symptom for the babies, which are the baby have weak muscle. They also have slow motor development where they taking longer than average to sit up. They also have delay in talking, and they also have a problem at birth. Then we go to the symptom for the teenagers. Teenagers may have a longer leg. They also have shorter torso, broader hip and small testicle, and they also may have small penis and large breast tissue, and they also have low energy level. And last one is the symptom for the men. Men may have low sperm count and no sperm at all, and they also have small testicle and penis and have slow sex drive. And the last one is men is less muscular compared with other men. Next we go to the treatment of Klinefelter's syndrome. The first treatment is breast tissue removal, where we remove excess breast tissue by plastic surgeon. The second one is speech and language therapy to help to resolve speech problem of people. And the third, testosterone replacement therapy to stimulate deeper walls, growing facial hair, and increasing sexual desire. And another treatment is physiotherapy treatment. It is to help to build muscle and increase strength. For fertility treatment, it includes artificial insemination using donor sperm or ICSI. The last one is occupational therapy to help with any coordination problem associated with dyspraxia. And the last one, Klinefelter's syndrome can be cured or not. Obviously, this disease does not have any cure yet because Klinefelter's syndrome is a condition that is present from birth, and also it is part of person's genetic code where it's made more difficult to be treated. Why this Klinefelter's syndrome cannot be cured? It is because there is no effective way that can be used to remove chromosome from cell to treat this syndrome. But there is a way that can treat this symptom that can reducing the effect of the disease on the duration and quality of life.
How is the disorder inherited? Is it dominant trait, a recessive trait, a problem with the number of chromosomes, or something else? Klinefelter's syndrome is not an inheritance disorder. It is a syndrome that occurs due to an error that happened during distribution of sex chromosomes in meiosis, which caused the gamete that produced at the end of meiosis to have an extra X chromosome. Klinefelter syndrome is neither dominant nor recessive trait because it is not an inheritance disorder, but because of the error in chromosomal distribution in either from sperm of father or from egg of mother, which caused the fetus to have 44 plus XXY chromosomes if the fertility happened. In short, this disorder is caused by a problem in the number of chromosomes. How common is the disorder? How many people have it? How many get it each year? Klinefelter's syndrome often occurs in newly born male child, with the probability of it to happen is 1 in 500 and 1 in 1000 child annually. However, there are also chances that a newborn to have more than one extra chromosome. That is 1 in 50,000 newborn child which have 2 extra chromosomes, XXY. And 1 in 85,000 to 100,000 newborn that have 3 extra chromosomes, 4XY annually. Is there a certain race it is most common in? Is it more common in men or women? Klinefelter syndrome is a disorder that randomly occurs because of the abnormality that happen during meiosis, which means there is no specific race where Klinefelter syndrome is common in. Klinefelter syndrome is a disorder that caused by the abnormality in sex chromosomes number, which is XXY, XXY, and 4XY. While this disorder is commonly occurs in male population, however, because female doesn't have Y chromosome, so Klinefelter syndrome never happen in female population.
How long is the average lifespan of a person with Klinefelter syndrome? A rise in mortality about 50% in males Klinefelter syndrome has been recorded. The observation was focused on 466 prospectively observed males over the last 25 years. The increase in mortality was associated with a lifetime loss of 5 years. How is the family of a person with Klinefelter syndrome affected? First, feeling burdened due to lack of knowledge. Second, feeling double-edged sword. And the third one is searching information by their own. Parents feel burdened due to insufficient knowledge regarding the syndrome. For example, how to manage their son's life, types of treatment that are available, and signs of Klinefelter syndrome. Double-edged sword, or as known as favorable and unfavorable consequences. Parents also facing double-edged sword toward their son with Klinefelter syndrome. Either their son will grow up being a cheerful person or expressing depression due to bullying, as well as poor level of learning in adulthood. Parents are afraid to see professional healthcare to inform their son's condition because they are disturbed by some picture of a sign that is fear that will cause their child to be judged or stigmatized. So, they more prefer to figure it by themselves. These are the signs of Klinefelter syndrome that the person will face it. These signs only occur to male and not to female. What have you learned personally from researching this disorder? First, knowing the sign of the Klinefelter syndrome. Second, gain information regarding the syndrome. And the last is understand type of diseases associated with Klinefelter syndrome. These are the several signs of Klinefelter syndrome. First, they have small testes. Second, infertility. And the last one is tall stature. Furthermore, gain information of medication treatment available for Klinefelter patient is testosterone replacement therapy. The last one is knowing type of diseases that associate with Klinefelter are cancer, for example breast cancer. The second is autoimmune disorder, for example rheumatoid arthritis, and the last one is osteoporosis. For the conclusion, Parents must always keep in touch with healthcare provider to get further information, giving moral support to encourage him, and last but not least, often spending time together will strengthen family's relationship.